last week, let me just say, I got a lot of feedback from people, mostly good, some bad. It was an emotionally charged subject when we talked about Steward Healthcare last week. All right. I mean, this is absolutely a topic that gets people's blood pressure up. I'm right there with you. Everybody recognizes there are problems. There are differing opinions on how to go about it. And that's a healthy discussion to be had, and I encourage it. We had a lot of people say, please don't lose track of this story. Stay on top of it, which we absolutely will. And as that discussion was going on, we actually had more developments came in. Let me just give a quick recap of what happened with Steward for those who didn't see the segment last week. And I've put a link down in the description below. If you want to go back and check that out after the stream, you can. Steward Healthcare filed for bankruptcy this year. They are one of the largest hospital operators in the United States. They own dozens of hospitals throughout the country. They have been bleeding those hospitals dry, paying themselves hundreds of millions of dollars in dividends while these hospitals have been going belly up. The hospitals' contractors and vendors have not been paid, leading to equipment being repossessed, and that has actually led to the death of patients. Now this company is also embroiled in a scandal overseas in Malta, where they did essentially the same thing. And then last week, when we were covering this story, we talked about how even though this company did not have money to pay for their bills, to pay for their doctors, they did have $7 million to hire former British military guys to spy on the short sellers and the regulators that were circling around the company, doing things like recording people in their homes, following them when they dropped off their children at schools, manufacturing fake financial and bank statements to try to make it look like the people investigating them were corrupt. So these guys are the full Monty. And well, we have got a big update on the Steward Healthcare story. And this one comes from CBS News on July 11th, which was that Thursday? That was Thursday this week. Steward Healthcare now under federal investigation for fraud and corruption. And this is U.S. federal investigation. CBS News has learned federal authorities in Boston have opened a criminal investigation into Steward Healthcare, a company that owns dozens of hospitals nationwide, including 9 in Massachusetts, according to 2 people familiar with the matter. Steward, which is based in Dallas, recently filed for bankruptcy. Federal prosecutors at the U.S. Attorney's Office in Boston are investigating Steward Healthcare based on various allegations, including fraud and violations of the Foreign Corrupt Practices Act, 2 people familiar with the matter said. And that's key there, that they're being investigated based on, number 1, fraud. That's implying domestic fraud. But number 2, violations of the Foreign Corrupt Practices Act. So Steward is being investigated by authorities in Malta, and I'm sure they're going to be investigated in the UK for that spying story. But now you've got U.S. law enforcement at the DOJ is going after them under the Foreign Corrupt Practices Act. So all these things that they're doing in Europe, they're going to face accountability for it here in the United States. That law prohibits U.S. citizens and entities from engaging in corrupt activities when operating overseas. In addition to its U.S. properties, Steward was tapped by the government in Malta to run 3 state-owned hospitals. That deal is now at the center of a criminal corruption probe playing out in the island nation. Neither Steward nor its executives have been charged in connection with the matter in Malta. I would add the word yet there because they almost certainly will. The Department of Justice didn't immediately respond to a request for comment, and neither would Steward. Steward filed for bankruptcy reorganization in May and is exploring plans to sell all of its hospitals. Bids for the Massachusetts facilities, which have remained open during the bankruptcy, are due on Monday. Senator Ed Markey, a Democrat from Massachusetts, issued a statement Thursday calling Steward just the latest example of corporate greed endangering our healthcare system. Steward must be investigated, and I hope the company and the corporate executives who facilitated Steward's actions face consequences that reflect the lives, livelihoods, safety, and security that they stole from our communities. So Steward Healthcare back in the news this week. They are actually being investigated by federal authorities here in the States, in addition to the authorities in Malta, and it's under that Foreign Corrupt Practices Act. That's interesting. So it pertains to what they were doing there. So, guys, we're going to stay on top of this story as it develops. This is a new development that the DOJ is now looking into them on top of the bankruptcy, and I am sure we are going to hear more about this story as time goes on. And
Jack,
yeah, go ahead, man.
Sorry, we had a couple of questions from the chat, if you don't mind, for you.
Absolutely.
I can't highlight them, but I'll just say them too if you don't mind. So the first question is, will anyone go to jail? Will they really go to jail?
Okay, let me see if I can find the comment here. First of all, will anyone go to jail? I'm guessing yes. I have a hard time believing nobody's going to go to jail, just because it's so high profile and so disgusting. And these people are living so high off of this, right? I mean, I showed the picture last week of Ralph De La Torre's yacht and this $40 million boat that has more square footage than the average house, several times the square footage of the average house. These guys have paid themselves so much money. And, this other company, Medical Properties Trust, that is associated with them. Let me tell you, after I shared the story we did last week about Medical Properties Trust, I had these absolute clowns on Twitter start bombarding my account. And I went and I looked at these accounts, and they're all new accounts. They're only like a year old. And the only thing they ever tweet about is Medical Properties Trust and Steward Healthcare. They're anonymous accounts. They don't have names. They don't have faces. And all they do is make comments about Medical Properties Trust. These guys are paid shills. I can tell you the people at Steward Healthcare, I'm going to give my opinion here, right? These are just some of the biggest dirtbags I've ever encountered in my work since I started doing financial YouTube. And that is a bold statement because I've encountered some pretty amazing dirtbags in my time investigating some of the frauds I've investigated. But what these guys are doing, and the fact that Ralph De La Torre, the CEO, is a doctor who took the Hippocratic Oath on top of that, and now his actions are leading to the death of patients, indefensible. Does that rise to the level of criminality? I'm not a lawyer, but I am sure financial crimes will be identified, especially as Steward has been going bankrupt. They haven't been paying their rent to Medical Properties Trust, and Medical Properties Trust has just been, as they go behind on their rent, just been making promissory notes and making loans back to Steward Healthcare to make them appear to be solvent, blurring the lines between the two companies. I think when the smoke settles from this story, I think it's going to be more than a few people in handcuffs on trial for what's going on at this story, and rightly so.
Thank you, Jack.
I never did find that comment. I don't know who that was. Will anyone go to jail? But that was a good question.
Will anybody go to prison? And it was Deborah. I don't know how to say the last name. I put it in the private chat. Okay. And then the second question comes from Raymond. And this is, why is my deductible $5,000 for a single male, 35 years old, and monthly cost still $400?
Well, Raymond, we're going to get a little bit more into insurance here. There's the comment there. $5,000 for a single male, 35 years old, and a monthly cost still $400. So, I mean, really, you're talking like, this is pretty much everything you're going to be out of pocket for, right? I mean, this is just like catastrophic insurance only, and still paying $400 a month. Look, I don't have all the answers to healthcare, guys. It's a charged subject. And like I mentioned earlier, I think the socialists are circling like buzzards around this story. People like Elizabeth Warren, Ed Markey, trying to capitalize on this for the government to take over healthcare and make it free for everybody. And, as we are learning with college and with healthcare and student loans, if you want to make something outrageously expensive, go ahead and make it free. All right. That's what I have learned. The easiest way to make something unaffordable is to make it free, because there is no such thing as free. If it's dependent on the work, the services, or the products of others, there is a cost associated with it. And, unless we're going to make the medical profession slaves of the state who need to provide their services against their will, essentially for whatever price we give them, then you have to admit that there is going to be a profit factor in healthcare. Doctors study very hard. They're very smart people. It's very hard to become a doctor. They're entitled to being generously compensated for the value that they provide. But at the same time, guys like Ralph De La Torre, who are adding no value, making no innovation, treating no patients, just vampires sucking the life out of the healthcare system. We have to figure out a way to protect the integrity of the healthcare system from those vampires. And I don't have the answer to that, guys, but I can tell you medical socialism will only make that worse. I guarantee you that. If you want to make it more expensive, go ahead and make it free. And we got another story about healthcare coming up later in the show, and it's going to have you shaking your head, guys. But There's some charts and things. Look at the stock prices of the insurers. Look at the profit margins of the insurers. All right. While your healthcare is getting so much more expensive, and while arguably the quality of your treatment is getting worse and worse, their profit margins keep going up and up. So something is fundamentally broken in that system. Thank you, Raymond. I appreciate the question, sir.
No, I just appreciate the follow, Jack. I think these are really important stories, and I think we're going to continue to see more and more about this, and we'll follow it all the way through, and hopefully we will see people go to prison, because it is, unconscionable.
And I would add the importance of people being prosecuted and not just writing checks and paying fines. There has to be a deterrent in this, right? I mean, the next guy, if all we do is slap them on a wrist and the fine is a few $1 million, then there's nothing stopping the next guy from doing it. So, prosecutors, DOJ, don't slow walk this one. I can tell you that. This is way too important, and this affects way too many people.